So, my dear friends, have a look at my face. I am going to share something special which we mostly overlook, and we have the chance, but we miss the remedy. So, please have a look on my face. This was something which I want to share with you as being a homeopath or homeopathic practitioner. When we have a patient in front of us, we mostly have something which we needed, and we provoke the patient and we dig up and want to get the information from patient. But what about the thing a patient gives us, shows us involuntarily, especially when we ask something about his sickness, about his disease, and he gives us something which are not verbal but something like acting, and also a in a confusing manner. So we also become confused, and we wait for his words, for answer. But if we look at the reaction of the patient on our question, the answer is also available at any level. As you see, in the beginning, I made some gesture, I made some expression, some face expression, and these expression are always present in our patients, but we neglect it or we ignore it and miss the remedy, and we frequently ask the patient, what is your problem, what is your problem, and patient is giving us answer through his action, through his gestures, through his grimaces. So the word which I used for this action is grimaces. So what is grimaces? Grimaces are something which is expressed by the expression of patients in the extraordinary way. So, what is extraordinary? Something which is not usual, and which is confusing, which is also, which maybe this action becomes patient peculiar when he is in front of us or when we provoke about the answer. So, as far as the grimaces is relate, there are some general remedies in old Kent repertory under the rubric Grimaces. But in new repertories, in trending repertories, there are some other sub rubrics which are also present. The main remedy of grimaces is belladonna, hyoscyamus, hyoscine. But along with this, there are some other remedies which also have this type of gesture, this type of condition. So, although this is a very short rubric, but it is very useful in our daily practice, in our common practice. Mostly, if we see one patient who has this kind of gesture, these kind of gestures or face expression during the questioning, and he also has the behavior, the patient wants the doctor to explain the reason. So these two rubric confirm the remedy belladonna. And if we see the some other sub rubric, so hyoscyamus has the mostly covering remedy of these grimaces type of actions. So it is very useful rubric. It is very common rubric. Please keep it in mind and use it for your simile. Thank you for watching.